Hi, my name is Samantha Neely, and today we will be conducting all of the fitness tests that we have done thus far. First, we're going to start out with body composition tests, and we're going to do a simple heart rate to start off. I'm going to be using just a stopwatch on my phone, and I'm going to be taking her heart rate for 30 seconds and multiplying that number by 2 to get her heart rate beats per minute. We're going to be getting her heart rate from her radial artery, which is going to be on the lateral aspect of her wrist, right at the base. I'm going to palpate for that until I can feel it. All right there. And I'm just going to be taking it for 30 seconds. All right. I got 34 beats in 30 seconds, which is 68 beats in a minute. So your heart rate is 68 beats per minute, which is great. The average is 70 beats per minute, so you're right on target there. Next, we're going to be taking the blood pressure. So I'm going to put the blood pressure cuff on her left arm. And we are going to be putting the artery line matching up with the brachial artery, which is on the underside of her arm. So this is the line right here, and we're just matching that up right onto the inside of her arm, the brachial artery. And then I'm going to just secure this, not too loose, not too tight. Next, I'm going to secure this sphygmomanometer, which is going to give us our reading. Just going to clip that right onto the cuff. And I'm also going to be using a stethoscope to be listening to her blood pressure. All right, so we're going to have two numbers. We're going to have a top number and a bottom number. The top number is systolic, which is when the heart contracts, and that's pumping the blood into the arteries and throughout the body. And the bottom number is diastolic, which is when the heart relaxes and lets the heart fill back up with blood. So as I'm listening to this sphygmomanometer and putting the stethoscope onto her forearm right here, onto that brachial artery, I am listening for her heart rate to appear. When her heart rate appears and I can hear it, that is when the top number is red on the sphygmomanometer, and when her heart rate disappears, that is the bottom number reading. So I'm going to go ahead and place everything in place. Just go ahead and relax your arm. And we will start now. We'll tighten it up and we'll take it. All right, I got 108/72, which is healthy. The normal is, the average is 120/80. We already know that she has low blood pressure, but it's not anything to be worried about. Hypertension is something that we need to be worried about anytime the blood pressure is higher than average significantly, but this blood pressure is a very healthy reading. Our next measurement of body composition is going to be the 3-site skin fold test using a fat caliper. Since we are working with a female, we're going to be using the thigh measurement, the suprailiac measurement, and the tricep measurement. So I went ahead and marked off all of the places that we're going to be measuring. The first part is the tricep measurement, and that is just, we're going to be getting the belly of the tricep muscle equidistant from the acromion and the olecranon process. So I went ahead and measured that off. You can go ahead and stand up and face the camera now. The next measurement is going to be the suprailiac measurement. So we are going to follow the natural diagonal of the iliac crest and then just move right above that. I don't know if we can see that on camera, but yes, thank you. Marked off right here to measure with that little X. And then the third measurement is going to be the quad or thigh measurement, which, can you go ahead and scoot back so you can show the camera where we marked it off? It's going to be right here. So once again, measured that inguinal line to the top of the patella bone, and we just got the point that is equidistant from both of those. All right, so first off, we're going to start out with the tricep measurement. Go ahead and turn around for me. Thank you. And what I'm going to do, the technique here, instead of grabbing perpendicular to the muscle, I'm going to be grabbing parallel with the muscle. This technique helps me to grab the fat tissue and the subcutaneous tissue without grabbing the belly of the muscle, because we're only wanting to measure the fat layer here. It's also important not to just grab the thin subcutaneous layer. So we want to grab somewhere in between, right where the fat layer is. Go ahead and flex for me, your tricep. All right, awesome. You can relax now. So I just had her flex her tricep just to make sure that I'm not grabbing onto that muscle at all. I'm going to grab, pinch, then I'm going to put the fat caliper right on that area. And we are right at 16 millimeters for that measurement. Next, we're going to do the suprailiac measurement. So you can go ahead and turn around and stand up for me. We're doing all the measurements on her left side right now. So once again, I'm going to grab parallel with the skin and get that measurement, which is at 18 millimeters. And the last one is the thigh measurement. Once again, I'm going to be pinching parallel with the skin. And we are right at 19 millimeters, what I'm seeing as I'm measuring right here. And those are our measurements for the skin fold test. The last measurement of body composition that we're going to be measuring is the hip to waist ratio. So I am going to be using a soft measuring tape on the centimeter side of it, and we're going to be measuring her hip first. So for her hip, we're going to be getting the largest portion of her hip. So if you can turn sideways for me, we can kind of see where the largest portion of her hip is, which is about here. So I'm going to go ahead and just measure the circumference of your hip. Not pulling too tight or not leaving too much slack. We want to get that natural circumference. And that falls right at 101.5 centimeters. Now we're going to move on to the waist measurement, which you can face the camera. We're getting the smallest portion of her waist, which happens to be right at this point right here. So once again, I am going to roll up my measuring tape so I can start from scratch. We're going to be measuring this on the centimeter side again. So go ahead and put your arms up for me. Thank you. I'm going to put that right at the smallest portion of your waist. So you can keep your arms right where they are. And that measurement comes out to be 78.5 centimeters. Once again, I'm not pulling the measuring tape, I'm just letting it lay down. Next, we are going to be measuring her flexibility. So we're going to start off with the YMCA sit and reach test. To set up the test, I put a yardstick on the ground and I marked off the 15-inch mark. So her heels are sitting right at the 15-inch mark, and the rest of her body is behind it. Now, when we are performing this test, we are seeing how far she can reach onto the yardstick. When she is doing that, it's important that she keeps her legs straight the entire time, so no bending her knees. It's also important that she keeps her hands right on top of each other. We don't want one hand reaching farther than the other. And the last thing is that we want to make sure that it's not a ballistic stretch, so we don't want her reaching and kind of doing that ballistic motion, trying to get further. All right, do you have any questions before we start the test? All right, so go ahead and put your hands right on top of each other. And when I say go, I'm going to have you just go ahead and reach as far as you can. We're going to do this test twice. Please put your hands on the ruler, and you're just going to slide them forward. Go ahead. All right, so you can release. For that part, you were right at 18 inches. And now you can go ahead and perform it a second time. And reach. All right, let go. That one you got to 19 inches. So between those two measurements, that is an average of 18.5 inches. The next assessment of flexibility is going to be measuring her major joint angles on her left side with the goniometer. So we're going to be measuring elbow, shoulder, hip, and knee angles. First, we're going to start with the elbow. So go ahead and lie supine on your back with your head on this side, since we're measuring your left side. And go ahead and just lay in a neutral position. Now, ideally, we would want to be on a table where the surface is perfectly flat, but since we're doing this at home, I'm using a couch, and I understand that the angle might be a little bit off since the surface isn't as firm as I'd like it to be, but that's what we're doing. So for the elbow, the fulcrum of the goniometer is going to be at the lateral epicondyle. So I'm going to palpate for that. Go ahead and just relax your arm. There we go. Palm up, since that's, yep, there you go. So palpating for that lateral epicondyle, which is right here, and I'm going to just place the fulcrum of the goniometer right there. Now, the immovable part of the goniometer is going to be in line with her humerus, and the movable part of the goniometer is going to be in line with her radius. Now, I'm going to have her bend her elbow as far as she can go when I say go, and we're just going to measure that joint angle. So, as you would like, go ahead and bend your elbow, and I'm going to get this movable arm with you. You can do it slowly. All right, so that angle is right at 140 degrees of elbow flexion. Next, we're going to be measuring shoulder flexion. So we're going to be putting the fulcrum of the goniometer on the humeral head. So the humeral head is just right at the top of her humerus, right where it meets the acromion. And for this one, the immovable arm is just going to be in line with the rest of her body, and the movable arm is going to be in line with her humerus. So if we can get a closer reading on that. I'm going to have you, when I say go, you're going to keep a straight arm, and you're going to lift your shoulder as far back as it can go slowly so that the movable arm can track you. Go ahead. There we go. You can go as far back as you can. Is that as far back as you can?
Yes.
All right. So we have the fulcrum still at her humeral head. movable arm is lined up with her humerus, so I'm going to go ahead and look at that measurement, and it's right at 160 degrees, so if we can get close enough to see that, the measurement right there is 160 degrees of shoulder flexion. The next thing that we're going to be measuring is hip flexion. Now with hip flexion, there are a couple ways to measure it, but I prefer to measure it with a bent knee. With a bent knee, that means that we're putting the hamstring on slack and we're getting a better measurement of hip flexion without factoring in if the hamstrings are tight or loose, and we're just measuring that hip flexion. So we are going to be putting the fulcrum of the goniometer at the greater trochanter of the femur. So that is up here. I'm going to have you put your hip through that range of motion, the hip flexion, really quick to make sure that I'm at the axis and where it rotates. Go ahead and put it back down. All right. So we have the fulcrum right approximately here. And we are going to be putting the movable arm right in line with the femur. We're going to put the immovable arm just in line with the rest of the trunk. When I have her flex her hip, I'm going to remind her to keep that knee bent. Do not let it straight, because then that's going to put the hamstring in a flexed position and it's not going to get an accurate reading of that hip flexion. So when I say go ahead and slowly flex your hip. Go ahead. Keeping that in line with the femur as far as you can go. All right, right here is where I'm going to stop that measurement because I felt the end point in her hip joint right when her pelvis is wanting to rotate. We don't want the pelvis rotating or the back getting involved in this because that's kind of measuring lower back flexion and pelvic rotation, and since we're just measuring the hip flexion, I'm going to stop it right there. So that reading on that is going to be right at 75 degrees of hip flexion. The last major joint that we are going to be measuring is the knee, so we're going to see what type of knee flexion she has. I had her flip into a prone position because we're still measuring that left side. So I had her flip on the couch and go into a prone position. For the knee, we are going to put the fulcrum at the lateral epicondyle of the femur. So we're going to find that right on the side right here. And we are going to be putting the immovable portion of the goniometer in line with the femur. The movable portion of the goniometer is going to be in line with the lateral epicondyle of the fibula. All right, so when I say go, I'm going to have you flex your knee and bring it to your butt as far as you can go in a slow manner so we can control it. Ready, set, go. Go ahead all the way that you can. All right, just making sure that those are still lined up. Perfect, go ahead and hold it there for 1 second as I get that reading. And we are sitting right at 128 degrees of knee flexion on that left side. Now we are going to be measuring muscular endurance using the ACSM push-up test and the ACSM curl-up test. First, we are going to start with the push-up test. So, since we are dealing with a woman client, we are going to be using a modified push-up, which is on the knees, and I will demonstrate that for us. So our hands are going to be shoulder width apart, our knees are going to be touching the floor, and our feet are going to be in plantar flexion. So we don't want our feet assisting us in any way, just kind of in a relaxed state there. Now, with the back, we want the back in a neutral position. We don't want it arching like this. We don't want it dipping like this. A common mistake when trying to do the push-up is pushing up with the stomach first, touching the ground, and then coming off. or when we're coming down, touching the stomach to the ground first and then going down. We want to keep that spine in a neutral position the entire time. So we're going to start with our chin touching the ground, and as the test starts, we're going to be going into the up phase and then the down phase again. It's important that the chin touches the floor, but not the stomach. Going into the up phase and then back down counts as one push-up. When the client cannot do any more push-ups, then the test ends. Do you have any questions?
No.
No? All right, now let's get into our position. All right, now flat back, chin touching the ground. Now you're going to keep your back straight as you are pushing up. Nice feet form. And remember, it's a knee push-up. All right, so when I say go, you can go ahead and push up and see how many you can do. So go ahead. No? All right, so when we tried this test before, she was unable, you can go ahead and sit up. You can, she was unable to do a push-up, still unable to do a push-up, which is what we're going to work into our exercise prescription, so we can hopefully get you doing some push-ups soon. And yeah, so she's in the needs improvement category, which there's only a way to room to go up from here. Next, we are going to be doing the ACSM curl up test, and there's a couple things that we need to set up this test. First, I have her on a flat mat so that the sliding surface is easier for her fingers, and we set up masking tape. So the masking tape is put so that it is 8 centimeters apart. This is going to be the distance that needs to be traveled with her fingers as she's performing the curl up. It is 8 centimeters apart for individuals that are 45 years of age or older, and for individuals that are younger than 45, we are going to make that distance a little wider at 12 centimeters. But for this case, we are using the 8 centimeter distance. So another thing that is necessary for this test is a metronome. So I'm just using a metronome app. The beats per minute is going to be set at 40 beats per minute, and that is the pace that needs to be kept for the entire duration of the test. So as we are performing this curl up test, you're going to be in a supine. I'm actually going to go this way so that my arms line up correctly. We're going to be in a supine position. Fingertips are going to be right at the edge of the first tape mark, and knees are going to be at a 90-degree angle, just in a nice relaxed state. As the metronome beeps, and we're keeping up with the beep, we're going to slide our fingers up until we get to that second piece of tape, and only that second piece of tape. You don't need to go any farther, and then you slide back down. You have to keep the pace the entire time, and when that pace is not able to be kept up with, or she reaches 70 repetitions, then the test ends. Going from bottom to top to the bottom phase again counts as one sit-up. So the pace is going to be like this. So you're going to go up and then down, up and then down. Does that make sense? Mm-hmm. All right. So we have a friend visiting us doing the curl up test too. So we're going to have you lay with your head down here, and you're going to put your fingertips right at this tape and lay down accordingly. Yep. Just scoot until you feel your fingertips touching that. All right. So I'm going to give you a couple practice beats, and then I'll kind of help you start the test, but do not start performing the test until I say go. All right? You are going to do the test until you feel that you cannot perform the test anymore, or until I feel that you're not keeping up with the cadence of 40 beats per minute. Okay. Sound okay? All right, I'm going to show you the pace. Do not go yet until I say go. And do you have any questions before we start? No. All right, let's go. You got this. So going to go up, down, down. On this next one, go up, down, 1, 2, up, down, 3, up, down, 4, up, down, 5, up, down, 6, up, down, 7, up, down, nice job, 8, up, down, 9,
Okay, I'm done.
up. You're done?
Yeah.
Alright, well you got to 9 curl-ups until she could not keep up with the pace anymore, so that will be the end of the test, and her final score will be 9 curl-ups.